Hi, I'm Dr. Neil Shah, and welcome to the DBT podcast. Welcome to the DBT podcast. My name's Dr. Neil Shah. I'm a hematologist-oncologist trying to squash misinformation by having experts on. And today, I'm very lucky to have a very good friend of mine, physical therapist, a doctor for over 10 years. When you have an ache and pain, I many times think you should skip the doctor and go right to the physical therapist. Dr. Jana Richardson, thank you for joining the podcast.
Yeah, thanks for having me here.
Yeah.
Excited to be here.
Yeah. We talked a little bit with other doctors about their field and the history of their field. Maybe we can start with 50 years ago, what did we understand about physical therapy and maybe in general, from my understanding, people in ancient times were doing massages and exercises to help improve the inflammation and the pain in the human body. You're an expert at that. So maybe you can talk about that a little bit.
Yeah, well, interestingly, it started off, I think, in the 20s or something, and it initially was called American women's physical therapy. It started off as women primarily rehabbing people post-war, and then it turned into obviously more and more people getting into the field, and then it morphed into the American Physical Therapy Association and whatnot. And I think initially it was probably a lot of just strengthening, just stretching, all of that, and then it's really morphed into, I think, more a biopsychosocial model, at least in the pelvic health world, which I think is really how it should be with our whole body, of looking at all different aspects of not only how much you're strengthening specific muscles, stretching certain muscles, but also looking at your nervous system, because that drives a lot of what your muscles are doing, or muscle tension, that I think a lot of people don't necessarily look at. They think oh, I just need to strengthen these muscles, or I need to do this stretch here and there. But in order for it to be a longevity thing, we really need to look at the full picture of socially what you're doing, what your goals are, what you want to be doing in 20 years, and then also your nervous system, and how that influences what your muscles are doing.
Yeah, I mean, I'll just speak for myself. I'm a board certified general doctor, and the muscles and the nervous system, it's not something I really knew about. In fact, even though I'm Hindu, I didn't start doing yoga till about 10 years ago. And I really, wasn't someone that stretched a lot. And I think even on TV, the athletes, there wasn't an emphasis on it. Mm-hmm. You get an ache and pain, you get over it. But really, how do we get older and not have those aches and pains? And I think you guys are the expert. In fact, I was, as I was telling you earlier before we started, one of my cousins is a physical therapist, and every time I have ache and pain, I don't call the doctor, I don't call the general doctor, I don't call the orthopedics. I literally just text him and tell him, and then he gives me some exercises, and it's better.
Yeah.
So I think you guys are sometimes doing magic, on fixing problems. And I know you guys are working on everything from dizziness to frozen shoulders to obviously, neck pain, back pain. And I know you specifically focus on one area of the body, and I think there's only a few of you. So you're really a niche expert in something.
Right.
Maybe you can talk about that.
Yeah. So it's really interesting because I never thought I would do this specific type of PT. I think I went to PT school thinking I was going to do what everyone else does, which is sports and orthopedics. Or I was a figure skater previously, so I thought I was going to do maybe a performing arts or something like that. And then I learned about pelvic health, and I was like, what the heck is that? I'm definitely not going to do that. That's weird. And then I learned a lot more. I was like, whoa, this is actually way more than just Kegels, and way more than just pregnancy care and women's health. So yeah, it just really drew my attention. And I think a lot of people just have no idea, or have never even heard of what the pelvic floor is or what it does. But it's, just like a bicep muscle or a glute muscle. We all have pelvic floor muscles, so we should all be aware on what those muscles do.
I now know a lot more about it since I picked up golf.
Yeah.
And my understanding is that you need your hips and your pelvis to move in a certain way to get that better. So I'm hoping by the end of this conversation, my handicap will get better by you teaching me, what to do to get better. And it's not just women that are affected, right? Men also. My understanding is you have a lot of male patients too that have a lot of pelvic issues. issues. Is that correct?
Yeah. So I also didn't think I was going to get into men's pelvic floor therapy. I thought I was just going to do female pelvic health because that's really what interested me. And then once I started seeing more and more men, I'm like, wow, actually, men need just as much help as women do. We all have a pelvic floor, as I said. We all have hip muscles. So they need it. And there's even less pelvic floor therapists who treat men than there are women. So it's even more like a niche of a niche and even more or just less known out there, and not a lot of people know where to go for that. But like, as you said, treating like hip mobility is so key for treating pelvic floor and vice versa. Your pelvic floor needs to be in good health also to help with your hip mobility, to help with your back mobility. So if you want to golf, if you want to, chase after your grandkids or whatever it may be, like I think a lot of people don't see the connection between your back muscles, your hip muscles, and your pelvic floor, but they all connect to one another if you look at anatomy.
Yeah. I bet you every single doctor, if they see 100 patients, 50 of them will have back pain.
Yeah.
And is that the most common symptom that you're getting as a physical therapist? Like, is that the most common, like just chronic pain of some sort, whether it be in the back or the pelvic area? Or maybe you can talk about what you're seeing the most as an expert.
I would say, that's a huge one, is back pain. I think a lot of people go to, like I say, quote unquote, traditional physical therapy to fix their back, which is usually involved with like stretching, core strength, hip mobility, all of that. And then sometimes like that doesn't always help, like that traditional type of physical orthopedic therapy. And then a huge part that's missing is the pelvic floor, because that's majority of people who have back pain, especially chronic low back pain, will have or do have pelvic floor dysfunction problems because those muscles connect together. And in order for you to truly strengthen your core efficiently, you have to be involving your pelvic floor with it. And I think that's a huge missing component, because people are like, oh, I just, do my crunches, or I do like these ab exercises. And it's like, if you're not really involving your pelvic floor with it, it's not efficient and it's not holistic in that sense to get you better long term.
What's crazy is I have a cousin who I'm very close to, and he has some chronic back pain.
Yeah.
And I think I'm going to bring this up to him.
Yeah.
He's had, and I think one important component is, okay, someone goes to the doctor, they're having pain, they have x-rays, maybe they even have an MRI. Everything looks okay.
Right.
Basically on that. So I think we're both on the same page, is that go see the doctor, make sure it's not, in my case, God forbid it's cancer
Right.
or, something else, or a bulging disc or whatever. But then if you don't, like, I guess what I'm wondering is, and I don't know the answer to this because I'm definitely not a muscle and nerve expert, but I guess what I'm really wondering is, like, how do you know it's a pelvic floor problem versus, something else?
Yeah.
Is it that you've kind of ruled out that it's not a cancer, it's not a, a structural problem in the spine? Is that how, maybe we can just focus on back pain in general?
Yeah.
Like, how do you think, like, maybe everyone that doesn't have another issue with their back who has chronic back pain should be referred to a physical, like a pelvic physical expert? Okay.
Absolutely. I think so, because if you're not looking at the pelvic floor, you're not looking at the entire picture of your back, because we know your whole body works in a system, like muscularly. Like your back muscles don't work in isolation. Your hip muscles don't necessarily work in isolation. Same with your core. So that you need to rehab those muscles like all together. And a lot of physical therapists, like, and this was me early on in my career, like I didn't take those extra courses. I didn't take those extra like board certifications at the time to really know how to rehab those pelvic floor muscles. But if you're not looking at that, you're like missing a whole picture. It's almost like treating your neck muscles or something like that and only looking at like one of the muscles. Like you're not going to get that much better, or to the potential that you have if you're not looking at the whole picture. But to answer your other question of like, how do you know if you have pelvic floor issues or dysfunction? Because a lot of people are like, I don't know. Like, do I? Is it just if I leak or something?
Yeah.
Like, and I think that's the most common, where people are like, oh, I'm leaking. I'm peeing when I like sneeze or jump or swing a golf club, something like that. And that's the biggest one, is like bladder issues.
I'm glad I did not pee while I swung the golf club last time. Awesome. But
But
if
you can
I
work
did,
on
at
it.
least I'll know.
Yeah. And you can fix it and work
Yeah.
on it. So bladder issues are like the biggest one, whether it's like leaking or peeing too much or feeling like for a lot of like postmenopausal women, it could feel like you have a frequent UTI and you actually don't have positive cultures.
Huh.
That can be, which is really
I
interesting.
actually have patients, so I'm learning like everything you're saying.
Yeah.
So, all
Yeah.
right.
And that's because it's a really frustrating stat, but like starting at the age of 31, women start to lose a significant amount of like lean muscle mass, and men start to lose that at age 55. So, especially for like postmenopausal women here and menopausal women, like we really need that like muscle strength early on to also help with our bone density later and all of that kind of stuff. So anyway, I know I went on a tangent there
No,
with
it's okay.
like menopause and whatnot, but that's, I feel like, a huge like new hot topic that we can really help with that a lot of people don't realize.
Yeah.
So anyway, bladder issues are the biggest one. Bowel issues are another big one. So constipation, not being able to hold, gas or bowels in. Pelvic pain is like one of my favorite things to treat.
Okay.
And I think a lot of people don't realize like you can help that. And I think that's really what got me into pelvic health is like seeing the quality of life changes with those patients. So a lot of people who maybe have tailbone pain or like sciatica in a way, or what's called like pudendal neuralgia, where it can feel really like zingy down there, uncomfortable, or pain with sex, testicular or penile pain. Those are all like big things that I work with. And I think the most obvious is like babies, perinatal health, birth prep, all of that. Pelvic floor PT is like another big aspect to help. And that's how you can tell too if you have like pelvic floor dysfunction, if you're having bathroom issues, any pelvic pain issues, any sexual health dysfunction,
Got
or
it.
feeling like even like pelvic organ
What
prolapse.
about just chronic low back pain?
Actually, chronic low back pain, that's a huge one. If you have chronic low back pain, there is no doubt that you have pelvic floor dysfunction too, because they go together. I think
Right.
the
It's
stats
not
are pretty
one.
high.
It's not one thing. Like
Yeah.
sometimes us doctors, we're not the best at. I think all human minds were like, okay, this thing caused this thing.
Yeah.
And sometimes it's more than one thing. It might be
Yeah.
that someone has some had an injury, and then as well as pelvic floor dysfunction or something like that. So are there exercises that people can do, like, so now just going to the part, okay, we know that human beings have pelvic floor dysfunction. You're obviously treating that. And the
Yeah.
cool thing about what you do, I think, is just that bottom line is the patients are going to just tell you, I'm feeling so much better.
Yeah.
And that's how you know you did a good job.
Yeah.
You got like feedback all the time,
Yeah.
which is great. And I also actually get, nice feedback, which is
Yeah.
really, I think our jobs, that's why we can be optimistic, because we see people, not everyone, 100% of people get better,
Yeah.
but we see people, we initiate some sort of treatment, and then we can literally talk to the person or see a picture that proves that what we did helped that person.
Yeah.
So I'm just wondering, are there things that people can do? So now we've kind of established that this is like an under-recognized thing. There's probably a lot of people out there that just have chronic low back pain.
Yeah.
I know you could see every patient, but if you couldn't and it's minor, tell me, like, what exercises do you think, like, now you've been doing this over 10 years.
Yeah.
You're a doctor. You're one of the experts in the country. Like, what do you think, like all of us should be doing to maybe prevent that, especially as we get older?
Yeah.
What should we be doing to like maybe prevent that, or
Yeah.
slow it down, or maybe not ever come to see you? I mean, I always joke
Yeah.
with my patients, I want to shut down my practice. So if there's no cancer and blood disorders, fantastic.
Great.
I'll just talk all day. So,
Yeah, exactly. Yeah. That's that's a really loaded question, but I think if I had to pick like one thing to focus on that everyone can focus on, really is like hip mobility and strength, because that's going to tie in with your pelvic floor, and then also help your back. So if your hips are nice and mobile and you're like stretching your hips, making sure you have good range of motion, you're not only going to help with like your pelvic floor, you're going to help with your back. You're going to help with your ability to like do what we call like functional activities. Like you're going to be able to golf, run.
So are you saying I should just golf as much as I can to
Yes.
improve my hip mobility?
Yes, I would say so. So hip mobility, I think, is like the number one.
Are there certain exercises that you do, like, getting up from a chair, or is there
Yeah.
2 or 3 different exercises that you kind of recommend for people maybe to do? Is there something you're going to do to say, okay, I'm in this field and I don't want to have these symptoms down the line. Maybe like, there's things that I do every day that I feel
Yeah.
like help my mental health and help my physical health. So is there some exercises that you yourself may do or that you'd
Yeah.
recommend?
Yeah, I mean, something that I commonly recommend that I also do myself are like called hip windshield wipers, where you're like either lying on the ground, depending on like what your level is. Your feet are far apart and you're letting your knees like fall side to side. And that helps to move both internal and external rotation of both of your hips.
Do you do that every day?
Yeah.
Okay. Do
Yeah.
you use weights with it? I'm just curious.
No, it's
Okay.
more a mobility thing.
Okay. All right.
And then another thing that I think is going to be helpful for everyone at all different levels, no matter where you're at, are like a glute bridge. That's where
Okay.
you're lying on your back, squeezing your glutes, lifting your hips up. That's like just a good overall core functional exercise that's going to work your hips, more of like a strengthening aspect, and then a little bit of like stretching in the front aspect, which, with our world of sitting and a lot of like, sedentary things that we just have to do in our world today, our hip flexors get really tight. Our glutes get really like elongated and weak. So that kind of counteracts that by doing a glute bridge, a few sets of those here and there.
Is that why as people get older, they get like much less flexible as well?
Yeah.
Okay.
Yeah, I think
'Cause of that.
because of that, like our glutes aren't strong. We're sitting a lot. Our hip mobility, isn't quite there. In other countries where they don't have like Western toilets, they're still squatting, and that actually helps a lot with their hip mobility and their longevity over time.
There is a product, we don't name products on the pod, but it rhymes with potty.
Yes.
And perhaps there's a squatty.
Yeah.
And I'm just wondering, like, so I've heard that can really help. I mean,
Yeah.
apparently, a lot of people do things that way. And
Yeah.
I've been to India where they have, obviously they don't have toilets per se. They have like holes basically that you go in. I think everyone's seen Slumdog Millionaire. So
Yeah.
are you seeing, so do you feel like over time that's definitely something where people are getting less mobile because they're not using those muscles basically? Is that correct?
Yeah, because a squat position, whether you're going to the bathroom or just being able to do that in general, really shows a lot about your overall like musculoskeletal health. It shows your ankle flexibility. It shows if your knees and your hips have good mobility there. It shows can you even get down into that position and the strength to get back up. So it really, that's like
So squats are good for you.
Squats are great for you.
Okay,
Yeah.
so maybe that's another exercise.
Absolutely. Yeah.
Oh, cool.
That's functional that you do in your day-to-day life that really can help with so many different aspects.
Okay,
Yeah.
awesome. Okay, what about massages? So,
Yeah.
my wife loves massages.
Mm-hmm.
I, don't get as many. Should everyone in the world be getting like a massage like every week? And then there are different types of massages.
Yeah.
I get roped into having massages, which I'm fine with. But, are there different? Is there some type of massage that you think is better? Like I recently went for an Asian massage, and so like it was a lot different than any other massage I've ever had.
Yeah.
So is there one type of massage that you think probably benefits the musculoskeletal system more, or like what are your thoughts on that just in general?
Yeah. I don't know if I have a specific one that I would like recommend or think that one is more beneficial than others because there's so many different kinds. There's like, soft tissue, deep tissue, sports lymphatic massage, which is like very different. I think if you're keeping your joints, your body healthy, strong, you really wouldn't need as much body work. And if you do need body work, I think it needs to be like very specific. Like when I do soft tissue work on some people, I'm not doing like a generalized, like I'm just going to work all of the muscles in this area. Like I'm really like zoning in on like what muscle group is really tight and what needs to be released in order for that joint to function better. So in my
You're
opinion,
treating a symptom.
yeah, that's
Correct.
true.
Okay,
Yeah.
Is that right?
Well, yeah, I guess not all the time. Some people
Okay.
come to us for wellness too, where
Oh.
they're like, hey, I just want to make sure I don't have any symptoms
Wow,
yet, but I
okay.
want to prevent them from coming
Yeah.
on.
That's one of the reasons we're doing the podcast, right? It's like, yeah.
Yeah, so just kind of looking at it from that perspective, yeah, some people I'm treating symptoms, but other people I'm like, hey, your hip joint isn't moving as well as it could, or there's a big asymmetry in this joint in this range, like let's say
Range of
internal.
motion or something like that.
Exactly. Where I'm like, if we try to release this muscle, that'll help it be a little bit more symmetrical, which is then going to hopefully help prevent abnormal wear and tear on different joints. So we do have a lot of people that come in with zero symptoms, and I'm doing specific types of like body work or releasing certain muscle groups. And I think personally, that's what I think is more needed or a little bit better than just general
Massage.
Yeah.
Yeah.
Although there is a time and a place for just, being
It's
able
relaxing.
to like,
It's
to relax
relaxing.
your
You're just
nervous
sitting there.
system. Yeah,
Huh.
exactly.
Yeah, so there's a benefit that way.
Yeah, exactly.
Got it.
Yeah.
So these are silly questions, so I apologize.
No,
but
these are
like,
great questions. Yeah.
I'm being silly in the sense that like I don't understand this. So is it because I'm a wimp, or when they ask about the pressure of the massage, anytime you go to masseuse, they'll be like, hey, like low, medium, or high.
Yeah.
And if they go to medium, I'll start crying. Like and I just think maybe it's because I'm a wimp.
Yeah.
And like my wife, I'm like, she's just tougher than me. That's fine. But like, is there something to that amount of massage? And I'm okay being a wimp.
Yeah.
Do you get what I'm asking?
Yeah, I
the
do.
different pressures, like, does
Yeah.
that matter per se, or is it just how you feel?
I think it's how you feel because personally, I'm like your wife, where I'm like, just keep going, just keep pressing harder. Whereas like my husband's the opposite. He's like, I don't want that. Like that doesn't feel good to me. But then when I put on like my PT clinical hat, I'm like, I don't really need to press that hard, because if you are to a point where somebody starts like guarding or something like that, it's going to be like counterproductive.
Got it.
If you do it that way. But when I take off my PT hat, I'm like, yeah, I just want more pressure. So I don't really think there's like there's any specificity to
Got
it.
it.
Yeah.
That's what I wanted to ask.
Yeah.
So it's really just me being a wimp. Okay. And the other thing is like there's foam rollers in every gym.
Yeah.
And I've had trainers tell me, like foam roll, at night to loosen things up. What do you think about those foam rollers?
Yeah.
Does it help with the pelvic area? Because I just do
Yeah.
right now I'm doing like my hips and my calves, for
Oh, that's great.
example, because I run and I
Yeah.
just do it while I'm watching TV. It's not a foam roller is not expensive. Should every household in America, I don't want to like, depending on how many people end up listening to this podcast, like, should everyone have a foam roller? Should everyone foam roll every night?
Yeah. I mean, I recommend it a lot. I think it's great. I think it's a great way to do your own like body work, self-release work that's pretty inexpensive and easy. Are there other ways to do that? Yeah. Like I've told some people who don't want to have like more equipment, I'm like, literally just use a rolling pin that you don't use anymore. You can do the same thing.
Yeah.
But I think it's great. I think it's really helpful to have those tools, just because it's a great way for you to do your own work on yourself, that can make a really big difference. Yeah.
What do you wish? Now, you've done this for over 10 years. You've treated, probably thousands of patients. You've made so many people feel better. What are the things that you feel like the general public should know about, physical therapy in general? When they come in, like, what are the biggest disinformation, misinformation that you're seeing? And you don't have to point to any person or whatever.
Yeah.
But you wish kind of like, hey, you know what? Every single person comes in with this. And like, I have my things that I
What are your things?
well, my things are like, everyone thinks that, which is okay. To me, it's like I have this education. I spent years. So, people are like, hey, I have cancer, but there's 200 different types of cancer. Everyone has a different cancer. And then I'm a professor at Indiana University, and I had a medical student today, and I had to explain to him like, no, like there's 30 different non-Hodgkin lymphoma is one of the 200 types, but within that type, there's over 30 different types.
Yeah.
And that each of those are treated differently, because then someone will come in and be like, well, my friend has the same cancer, but he's getting this treatment. Why is that? So like just that general knowledge that cancer is not like one thing, even when the government talks about, a moonshot or whatever,
Yeah.
but there's like there's so many, it's so much more detailed than just quote unquote cancer, So that's my thing. I don't know if there's other thing.
Yeah.
And so, when companies advertise like, hey, I'm going to eliminate all cancer, or someone will come in and be like, hey, I read this research stat, there's this new vaccine that's going to eliminate all cancer. And I'm like, that's just, it's 200 different things.
Yeah.
It's not just one thing. So
Yeah.
that's probably for me, my biggest one, but I don't know. What do you think for you? Someone's usually there's some symptom they're coming to see you for,
Yeah.
and they want it gone.
Yeah.
And so probably as fast as possible.
Yeah, I think
And
I think mine is very similar to yours, where it's like people ask a lot, like, what are the general things that you can do to help with this back pain that I have, this shoulder issue? Like, what are the exercises? But I agree where it needs to be so specific for each person, because I'm not going to give you the same exercise for the same symptom that somebody else has, because it really depends on like what your prior medical history is. What other surgeries do you have? What does your mobility look like? The same exercise that I give to person A is going to probably not be helpful or fix the problem in person B. So it really, I think, needs to be very specific, and it's not necessarily like a generalized thing of like, just do these exercises and it's going to help your hip or back pain. You really need to have it like analyzed and looked at, and have the physical therapist look at the entire picture, like the entire medical history, your even back to like high school injuries, because your body can compensate in weird ways over time. And you might not think like, oh, I broke my ankle or sprained my ankle like in high school, it's not going to matter anymore, but it like really does. So I think that's a really big one. The other one I think is, if anyone has any surgeries, I think they should go to PT and do rehab and prehab, because you're cutting through some, muscles, you're influencing the connective nerve or the connective tissues. You're going to lay down scar tissue where if you're not moving
That's the doctor's fault. We're sorry.
I,
Some doctor, not me. I always refer to the PT.
especially like abdominal surgeries, because I think a lot of people are like, "Oh, you're fine." Like, I think it's more and more common for like obviously people are like hip replacements, ACL, ortho stuff. Like, it's very common.
You know someone in my family that had a surgery that probably should have been referred to PT, right?
Yeah, because it's really not. I don't think it's as intuitive for people to know how to move their abdomen.
Yeah,
they're like, "Oh, I move my knee joint. I move it back and forth. Great. I know how to. I need to rehab that." But it's like you don't really think about, I think, those other aspects. And your body's gonna do the same thing. It's gonna lay down scar tissue. You're gonna have like a little bit of immobility. You're gonna have lack of proprioception in that area. So you kind of need to like remember what to do and how to get those moving in a right way. Otherwise, you can develop more mobility or asymmetries later that could lead to other things. So more is like a preventative
I
thing.
think it's like the same issue that I have is like, everyone's looking stuff up online, and, it's like, then of course, you go and you see the doctor, you see a professional like a physical therapist, and you're like, well, I read this online, I can do this and that. And it's like, well, we went to school for a long time. We've been doing this now for over 10 years. Like, it's like, it's just a lot more detailed than that.
Absolutely.
And, I always think like, an AI is never going to never be able to do each of our jobs because of what you just said. Like, you're going to treat an 80-year-old with 5 different surgeries different than a 30-year-old who is pregnant, right?
Yeah.
So it's just different for everybody,
Yeah.
So, are you seeing like, so obviously, when you see patients and some of them, it's a mobility issue. I mean, I feel like, like I have friends that are, way more than me, are taller than me, or there's not too many that are shorter than me because I'm short. Regardless of weight, the mobility doesn't matter about your weight. Like, mobility is something, so I've heard about like passive stretching, right? So like improving your mobility, there are people that will stay in a passive stretch for 5 or 10 minutes. There's, certain companies that you can pay to get stretched.
Oh, yeah.
I feel like that kind of stuff you could probably do at home, but I just wanted to get your idea about that type of stretching. Like, you mentioned 3 exercises already, which was amazing. And then stretching wise, is there yoga, or does it not matter? Or is there certain stretches that you'd kind of like think about for everybody?
I think yoga is great. I recommend it to a lot of my patients, almost everyone, just because it works on like what we just talked about, the mobility, static stretching, also some movement with it, and then breath work, which I think is really important for stretching.
I've never, it's crazy you say that, because like I never used to think about my breathing, like ever. And now it's like, I'm really trying to focus on that. I didn't realize how much it affected, your muscles and your nervous system. And, a lot of times you hold your breath when you're stressed and all that, so.
That's a huge one, is like breathing. That's the foundation for all pelvic floor work, is diaphragmatic breathing. That's like the first thing I teach everybody, which is why I highly recommend yoga, because it, obviously focuses in on that. But that's the key to like, tapping into your parasympathetic nervous system, your rest and digest, so that your muscles actually can release and relax, and they're not in this like constant tension, tighten, fight or flight response. So
do you think that's another benefit for meditation and prayer?
Absolutely. Yeah.
Because like, whether you're religious and you pray or you meditate, like I think maybe that's another benefit for that? Or
Absolutely. Yeah, for sure. Because it helps to like relax everything. It can help your muscle health, your bowel health, your nervous system, all of that. And especially in our world where we're just, it's just such a go, go, go world, we're just more susceptible to our fight or flight sympathetic nervous system to be that dial is like so much higher that it's really hard to like tap into the other one no matter how much you try.
I think subconsciously that's why I started this podcast, because I'm not on my phone right now and I'm not doing
Yeah.
5 things at once.
That's
So,
great.
maybe that's why I did that. But is there a specific, I've heard some studies say around 10 minutes or so of meditation a day. Is there a specific
Yeah.
amount of time? I mean, obviously, if you feel great and you have the time to do it,
Yeah.
but, we're all in this busy world.
Yeah.
Is there like a minimum or amount of time and I don't think anyone's going to, I think doing too much of anything is not necessarily good for you, but, is there some amount of time that you think?
I would say at least, 5 minutes is great. It's hard for like first time meditators too, or people who like just cannot, it's hard for them just to settle in that. So I've told people, even if you're doing just a minute to start off with, that's still beneficial to slow your everything down. And then increasing that to, 5 is going to be beneficial too. 3 minutes, that's still beneficial.
Yeah.
You don't have to do like 20 minutes of meditation.
Well, that's it. Well, I think people don't know that, right?
Yeah.
Like there is some benefit even for 5 or 10 minutes.
Exactly.
Like just to your daily, because, it's really, I always think of all this stuff kind of as self-care.
Yeah.
And I just think we're better at, at least for me, I know when I get sleep, I'm just better at taking care of my patients, when I'm more taking care of myself a little bit,
Yeah.
So it sounds like that's something that everyone should do, this 5 to 10 minutes of prayer or meditation. And then is there like yoga? Like, I guess, I know people do it every day. I do it like 1 or 2 times a week, and sometimes I miss it because I'm too busy. Is there a period of time for that? Or is there, and there's so many different types of yoga. I got a feeling you know more about it than I do. Like there's, doing flow yoga, hot yoga, all different types. Is there something that you think that may be beneficial? Obviously, there's not a ton of studies on all that, but
Yeah. I think a gentle flow is great. Restorative is also really great for more so holding longer poses and really trying to tap into like more of that like breath work, relaxation. That's a really great start for a lot of people. But then again, I have some patients that are like, that's a really long time and hard for me to do to go to a yoga class or something. So I think just even doing yoga poses and just breathing in them, like a child's pose, a happy baby, and just doing, 5 breaths in those and maybe just doing 2 of those is going to be beneficial and sustainable for someone's like lifestyle. That can be a great start. That's still going to show a lot of benefits.
Yeah, I think it's just really helpful. I haven't had, I used to throw out my back and all this stuff, and I think once I started stretching more and really
Yeah.
focusing on that, it's just a hard thing to do because it's not
hard.
as fun, right? Like
It's definitely
like
not
if
as
you
fun.
go to some, whatever you do in terms
Yeah.
of physical fitness, running, or you can listen to music, or you're lifting weights or whatever. It's just a little harder to just stretch or meditate than do the other things.
It's so hard to just make our bodies be still for a little bit. But there, and this is, we're just talking about static stretching here. Because dynamic stretching is really important prior to like lifting, to sports, all of that, versus static stretching. So a lot of people, don't know the differences between those two.
I don't. I just learned about it right now. Yeah.
Because if you do static stretching before heavy lifting or before exercise, you actually like reduce your power and the strength of that muscle. I think it's like by 30% or something like that. So prior to doing activities, you want to do like dynamic stretching, which is more like movement with mobility, like inchworms or something, or like doing kicks or leg swings. Those are more so like a dynamic type of stretch, or world's greatest stretch is another one that people know of, where you're...
I do that one.
Yeah, exactly. Where you're like moving through it, not necessarily holding, and more the passive stretching is what you want to do after exercise, after activity, just to kind of like wind down your muscles better. But dynamic is what we want to do to prep our muscles.
Okay.
To prevent injuries too and things like that.
Okay. Awesome.
Yeah.
Awesome. So, let's say you, this chronic low, going back to the chronic low back pain, like what point should a doctor, okay, like, well, let me put it this way. So let's say I'm seeing a patient for chronic low back pain. Generally, we give them some, anti-inflammatories. We tell them to rest, maybe put ice or heat on it, and then, move around, start moving around. And there's now studies saying that you should just continue moving.
Yeah.
And let's say, a patient has, after 8 weeks, they have an MRI or an X-ray, everything looks good. Do you think at that point, everyone should just get referred to physical therapy then? Like at that point? Yeah, like I don't see the harm. You know what I love about what you do?
There's no harm
is
in
that
it.
there's no risk.
Yeah.
I talk about risk and benefits all the time, and I feel like it's amazing that, there's no risk to like moving your body. And in fact, I only see benefits.
Yeah. I mean, they literally say movement is medicine.
Yeah.
Exercise is medicine.
Yeah.
And there is, I think that's what's so great about it, and why usually it's like the first line of conservative treatment is because there is no risk really for most times to doing exercise. It's only going to benefit you, and not to like also off-put like what you're doing. I think actually it needs to be combined together of like, you need sometimes those anti-inflammatories. You need maybe injections combined with exercise for that to be both mutually beneficial, for it to like work all together.
Yeah.
And so I think it needs to be like a combined effort too. Like, yes, preventative medicine is great. Exercise is medicine and it's great. But especially when it's chronic and you need like a little bit of something else, I think combining both is really like the best way to get somebody better.
So, I mean, I think what you've told me today, this pelvic floor, everyone knows about the hips a little bit, but the strengthening the pelvic floor, like, I think it's under-recognized as, like, I mean, everyone wants to get, these arms and calves and whatever, but, like, I definitely think it's, do you agree? Like, I just think it's under-recognized as, an issue.
Right.
Like, and I'm wondering, like, so how many like pelvic physical therapists are there, let's say in Illinois even?
Gosh, I feel like really not a lot. I don't know the exact number, but I know wait lists for a lot of places are like 6 months long just to try to like get in to see one. And like I was talking earlier in, this conversation here, that majority of them only treat females. So for men, it's even longer of a wait list. Like I've even heard like a year, 8 months.
Are you saying your female colleagues are discriminating against men? Is that what you're
sometimes
saying?
I'm like, I think they need to open their eyes a little bit too. Of like, everyone has a pelvic floor. Like, we're not only going to treat a female shoulder.
I'm just joking around.
But I think it's just really few and far between. And it's so under talked about. And I think we're moving more into an age where we're, getting more on social media out there. I try to really help with social media and help put information out there of like what pelvic floor health is, and that it's not just strengthening. I think a lot of people know it as like Kegels, and that's what a lot of people maybe will preemptively start doing of like, oh, pelvic floor health, I just need to do my Kegels, where I really deter a lot of people to do that. I'm like, it's actually, don't just start doing them. I see a lot of people who start doing them to try to help preventatively, and then they develop more issues. Because really a lot of pelvic floor problems is too much tension in your pelvic floor. And I'm so many more times teaching people how to breathe and relax their pelvic floor, because that's actually what's causing the problem.
Awesome.
Yeah.
Awesome. Well, thank you very much for joining us today on the podcast. And, I definitely learned a lot. And I have a gift for you that I'll drop at your house.
Oh, awesome.
But,
thank you.
I don't know if there's anything else you want to talk about today.
Yeah. I mean, I think just spread the word about pelvic floor health, and it's not as taboo of a topic that it used to be. And I think if we continue that conversation going, we'll be able to eventually have this be a normal where, women after birth will be able to regularly go to pelvic floor PT. Men after prostatectomies or even before prostatectomies will go to pelvic floor PT.
I mean, I'm not seeing my colleagues, the other doctors, referring every patient for pelvic floor physical therapy. So
I mean, especially for
prostate cancer,
prostate, gynecological cancers, all of that.
Yeah. So, maybe we need to do a better job of doing that, getting the patients to you. But I also think, obviously, with a 6-month wait, it's difficult. So maybe, some people will hear this and, maybe down the line, you can sign up, wait 6 months and sign up to see you, or hopefully there'll be more people that are interested in the field.
I think so.
Like you. And then payment wise, my understanding is not every insurer will they cover the physical therapy, because that's always an issue for any
Yeah.
doctor. Are insurances, if a doctor writes an order, they're covering it, correct?
Yeah, it's
Okay.
pretty much covered by the same CPT codes or diagnosis codes as PT.
Okay, good.
So it's
Good.
just physical therapy,
Yeah.
just the niche of it. Just like if you were to go to someone for like a concussion or vestibular
Sure.
therapy, it's all
Sure.
under the umbrella of physical therapy.
And I heard even for like dizziness, they're using technology to help with that. I had a patient
Yeah.
today that she said they used some machine to help with their vertigo and dizziness because
Yeah.
of the crystals in their ear.
Yeah, that's a whole.
Um,
I'm like impressed by those therapists. I'm like, I
yeah.
don't even know what they're. I know they do very specialized things, and
Yes.
I'm like, I'm definitely not a vestibular therapist, but I appreciate all the things that they do because it's really fascinating.
I mean,
cool.
it's crazy nuanced how, for cancer, I mentioned there's over 200, and
Yeah.
we've like 50 years ago, we didn't know that there was this many different types of cancer and how to treat it and the biology of it. And now, like for physical therapy, like probably when was pelvic physical therapy like its own thing?
I think it like started in the 60s and then it really became more of like we finally had a subsection
Yeah.
of it in the American Physical Therapy Association like in the 90s.
Yeah. So that's
So,
just
still
recent, right?
pretty
It's so
new,
new.
yeah.
And I think it's amazing to me that we just keep learning and we keep being able to, really focus in on stuff that's going to work for
Yeah.
a specific thing. So,
Yeah. Well, thanks for
Awesome.
having me
Of
here. I
course.
mean, this
All
is really
right.
great to chat about
Yeah,
all
yeah.
the pelvic floor things and
Yeah, yeah.
physical therapy things too.
yeah. I mean, I think things have come a long way for humans to live in a good way. Like we can't always control what's going to happen or whatever, but
Yeah.
like, we all have these aches and pains, and like, how can we just, do certain things? And I think you provided some of those things, at least questions that I had.
Yeah.
Then I'm like, maybe I'm doing this podcast to just try to help myself for when things happen. So anyway, thanks a lot.
Yeah. Thanks for
All
having me.
right.